Thank you again for joining us today. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 1,155. That represents 5.8% of the total number of tests and takes the total number of confirmed cases in Scotland to 177,688. 337 of those new cases were in Greater Glasgow and Clyde, 207 in Lanarkshire and 147 in Lothian. The remaining cases were spread across 11 other Health Board areas. I can also confirm that by 8:30 a.m. this morning, 515,855 people had received their first dose of the vaccine. 1,958 people are currently in hospital. That is 25 less than yesterday. 144 people are in intensive care, which is an increase of 2 from yesterday. And I am very sorry indeed to report 70 additional deaths have been registered in the past 24 hours of a patient who tested positive over the previous 28 days. That means that the total number of deaths under this daily measurement is now 6,040. The fact that more than 6,000 deaths have now been registered in our daily figures is another distressing reminder of the toll this virus has taken. Each and every one of those deaths has caused heartbreak to families, to friends, to loved ones across the country. And so, once again, I want to send my sincere condolences to all of those who have lost a loved one during this pandemic. I'm joined today by our Chief Nursing Officer, Professor McQueen, who will be helping me with the journalists' questions shortly. Before that, though, there are a few issues I want to provide some updates on. I want to start by saying something about the situation in the Western Isles, which most of which is currently subject to Level 3 restrictions. 6 new cases of COVID were reported in the Western Isles today, and 9 new cases were reported yesterday. I know that might not sound like very many, but of course the population of the Western Isles is relatively small. So proportionately, these are high numbers. In addition, as some of you may remember, these cases follow on from quite a high number of cases 2 weeks ago, including a significant community outbreak in Barra. All of that is placing significant strain on hospital capacity in the Western Isles Health Board area. In fact, the hospital in Stornoway has now reached full capacity. So it is therefore vital that we do everything we can to stop community transmission. For that reason, we are urgently examining whether the whole of the Western Isles will now move from Level 3 to Level 4. Barra and Battersea are already in Level 4 as a result of that recent outbreak in Barra. That decision on the whole of the Western Isles will be taken today and would mean that everyone, like everyone in mainland Scotland, must stay at home unless for an essential purpose. While that consideration will be completed over the next couple of hours, I would urge people to please not wait. Please stay at home wherever possible and help your local National Health Service through this. There are 3 other issues I want to provide a brief update on. The first concerns international travel. As you know, it is currently illegal for anyone to travel to or from Scotland without an essential reason. Even with an essential reason, anyone travelling from overseas will be subject to quarantine requirements. And in most cases, they will have to have had a negative test result prior to their departure. In relation to some countries, there are even tighter restrictions in place. A travel ban has been applied to visitors from certain countries or places where there is a heightened risk. Last night, the Scottish Government, the UK Government, and the other devolved administrations announced the extension of the travel ban to 3 additional countries, including the United Arab Emirates. So, for those countries, all travellers with no exemptions will need to self-isolate. These requirements came into force at 4 a.m. this morning. There will also be a ban on aircraft carrying passengers from United Arab Emirates. This will apply from 1 p.m. today. Anyone who travels from the UAE to Scotland via a third country and who is allowed to enter Scotland will still be required to self-isolate for 10 days. These measures are in direct response to concerns about the variant which was first identified in South Africa, and further information about them can be found on the Scottish Government's website. However, it is important to emphasise the basic message on travel remains unchanged. Don't, if you can possibly avoid it. That is why it's illegal to travel to and from Scotland right now, unless it is for an essential purpose. The second issue I want to touch on is about Scotland's testing capacity. When we published our revised testing strategy in October, we set out plans to establish 3 regional laboratory hubs for processing tests. 2 of these NHS Scotland hubs opened in Glasgow and Aberdeen in December. The third, based in Edinburgh, opened at the end of last week. And once again, I'm grateful to everyone involved in setting them up and operating them. Together, the 3 hubs will increase NHS Scotland's testing capacity to around 35,000 tests per day. And they will increase our total testing capacity, which includes Scotland's share of the UK-wide Lighthouse programme, to more than 65,000 tests a day. In addition, a new mobile processing laboratory has now been deployed in Aberdeen as part of that UK-wide testing programme. The mobile lab will process test samples from drive-through testing sites at Aberdeen Airport and mobile testing units operating in Aberdeen and Dundee. And it should help reduce the turnaround time for test results in the northeast of Scotland. Of course, as capacity increases, we're continuing to look at how we can make testing more accessible, particularly for people in remote and rural areas. As part of that, we've been trialling a scheme in Highland and Argyll, which involves the use of fire stations as testing centres. 2 sites have been run in partnership with the Scottish Fire and Rescue Service, and since the 6th of January, they've been operational from Monday to Friday for 3.5 hours each day. Following their initial success, I can confirm that these trials will be extended for a further month, and as a result, the 2 fire stations in Thurso and Loch Gilphead will continue to be used for testing until the end of February, at which point we will evaluate how well that has gone and look to see if we will expand it further. And I'm very grateful to the Scottish Fire and Rescue Service for their joint work with us on this. Anyone who has symptoms of the virus and lives within driving or walking distance of these locations can book tests by contacting NHS Highland. By extending the trial, we're trying to make testing as easy as possible for people in these communities, and we will continue to look at how this model can be rolled out across the country. My final update today concerns the progress of our vaccination programme. As of yesterday, around 96% of residents in care homes for older people had received their first dose of the vaccine. 68% of people over 80 and living in the community had received theirs. And so we're well on track to complete the vaccination of both these 2 high priority groups by early next week. On Monday, 2 more mass vaccination centres will open at the Edinburgh International Conference Centre and at the P&J Live in Aberdeen. You'll remember, of course, that 1 mass vaccination centre is already operational at the NHS Louisa Jordan in Glasgow. Smaller vaccination centres are also opening across the country. Many of these are located in community facilities such as village halls and sports centres. The opening of these new centres allow us to further ramp up the vaccination programme now that we are meeting our initial targets. Everyone aged 70 to 79 and all extremely clinically vulnerable adults should receive an invitation letter for a vaccination by the end of this week, and subject to supplies, all of them will have received their first dose of the vaccine by mid-February. In addition, the scale-up of the mass vaccination centres in Edinburgh and Aberdeen joining that one in Glasgow means that invitation letters will start going out next week to 65 to 69-year-olds in Lothian, Grampian and Greater Glasgow and Clyde Health Board areas. In other areas, planning is well advanced and letters will be sent out within the next 2 weeks, although we do expect most of those letters to be arriving in the coming days. I want to take this opportunity to thank all of those who've been involved in setting up these new centres, and to thank all the staff who are working so hard with us to administer and support the administration of the vaccination programme. So our vaccination programme is making good progress, and we will continue to do everything possible to speed up its delivery. But at the same time, all of us must continue to do everything we can to slow down the spread of the virus. And the way we do that is by following all the rules and the guidelines, with no exceptions. So I want to close today, as usual, by summarising what those are. The basic rule at the moment is stay at home. In any level 4 area, which is almost all of Scotland, including all of the mainland, you must only leave the house for essential purposes, such as caring responsibilities, essential shopping and exercise. If you meet up with someone outdoors, you can only meet with one other person from one other household. You must work from home if you possibly can, and employers have a legal duty to support people working from home. And on any occasion that you do leave your house, please remember facts. Wear face coverings when you are doing essential shopping, avoid anywhere busy, clean hands and surfaces, use 2-metre distancing if you're talking to someone from another household, and self-isolate and book a test if you have symptoms. Above all else, though, please stay at home as much as possible. And please follow the spirit of the law, as well as sticking to the letter of the law. Please don't do as much as you think you can get away with. Think instead about how you can minimise the meetings and the interactions you have, any one of which might allow the virus to spread. That remains the best way of keeping ourselves, our loved ones and our communities safe, and of keeping the virus under control whilst the vaccination programme continues. So please, stay at home, protect the NHS and save lives. And thank you to all of you who are doing just that. Now, let me turn to the journalists who've joined us this morning, and the first of those is Andrew Cree from BBC Scotland. Andrew.
Thank you. There's another row about the publication of supply data. If Nicola Sturgeon does now go ahead and publish figures next week on supply to defend the rollout, does this put UK supply at risk, particularly from the EU? Also, Germany's Vaccine Commission says there's insufficient data about rolling out the AstraZeneca vaccine to the over 65s. Are there genuine concerns about its effectiveness, or is this just perhaps sour grapes?
Thanks very much, Andrew. I'll ask the Chief Nursing Officer to help me with particularly your second question. But on your first, no, it doesn't. And the bottom line here is that the UK government has repeatedly briefed key statistics on how much vaccine has been allocated and delivered to Scotland. So it's not credible for them one day to tell journalists, perhaps like yourself, what these figures are, and another day tell us that putting out those figures are a matter of national security. That circle really doesn't square. We've held off publication in the past at their request, but that's no longer tenable. So the public have a right to clarity, and we will give them that. We're not talking about future supplies, we're talking about known supplies. And I think that is exactly the right thing for us to do. On the question about the views expressed in terms of the AstraZeneca vaccine in Germany, our starting point, my starting point as the Health Secretary, is the regulatory body and the independent clinical advice. So the regulatory body is the MHRA, the independent advice on vaccines and immunisation is the Joint Committee on Vaccines and Immunisation. That's where we go to for the advice to us on whether or not a vaccine is safe, how effective it is, who it is effective for, and whether or not there are any particular conditions that we need to be sure we follow when we administer the vaccine. Here, that has come to us from the MHRA and the JCVI, and in common with countries across the UK, that's the advice we're following. The bodies in Germany have not said that the vaccine is safe. As I understand what they've said, they have said that they believe that they need more data to make certain other opinions about the use of the vaccine. Our regulatory body believes that in looking at the data that they have, they can give us safely, as they have done over many years, give us safely the advice that they've given us. So that's the advice we follow. And of course, as we know, in all vaccination programmes, as you continue to vaccinate, more and more data comes to you in real time, if you like, and that data is constantly scrutinised and looked at to see if there is any modifications or addition to the advice. Should that come, of course, we would apply it. Fiona.
Secretary, thank you. For all trials of medicines, there are 4 phases. So the first, phase 1 and 2, are about, is the dose right, is it safe? Phase 3 is where it's applied more widely once there's a confidence that the vaccine is safe and also that we know what dose to give. So phase 3 for AstraZeneca were around age 18 to 55, 55 to 69, and then the over 70s. We absolutely know it's safe. We absolutely know that antibodies are produced right across all age ranges, so the over 65s as well as younger people, and we know that older people's immune response is often not as strong, but the AstraZeneca research demonstrated that the antibodies that were produced by the older age group of over 65s were in more than adequate quantities. What they didn't see is there wasn't sufficient numbers to see what happened actually when you got the disease. And that is the phase 4 of trials, is once the medicine, in this case the vaccine, is licensed and in use, then that can be monitored and that will give more data. We're absolutely confident that the AstraZeneca vaccine protects against serious disease, and that's principally what we're aiming to do at the moment. Yes, we want it to prevent transmission. Yes, we would ideally like it to protect against any disease at all, but we're absolutely confident that this AstraZeneca vaccine is solid, it is safe, and it is good to protect our over 65s.
Thanks very much. So Gordon Cree from Scottish Television.
Thank you. I've been having a tour of the EICC vaccine facility this morning, and very impressive they've pulled that together. But how concerned are you about the future supply of vaccines given the row with the EU? And can you offer an assurance that everyone who has been vaccinated, that the second dose they receive will be of the same manufacturer as their first dose? And if I can also just ask you briefly on schools, we've seen the last few days the test positivity rate very encouragingly now into the 5% bracket. Is it a realistic possibility to think there's a chance that the youngest age groups might be able to go back mid-February?
Thanks very much. Gordon, let me take your questions in turn. The first on supply. We've talked about this before here at these briefings and indeed elsewhere. So the UK government, on behalf of the 4 nations, has contracted to receive volumes of supply from both Pfizer and AstraZeneca and Moderna, which will come to us, we anticipate, in April. However, we've talked before about the lumpy nature of manufacture and how the supply comes out. It doesn't come out neatly, especially in the early days of manufacture. And so that can make it very difficult to be absolutely predictive about exactly the numbers that will arrive next Tuesday and then next Friday and so on. But we are in constant touch across the 4 nations, understanding what is coming into the country, what's being produced by AstraZeneca, what's on its way to us, that population share of 8.2%. So that allows us to plan a bit ahead, not as far ahead as everyone would want. Matt Hancock would want to plan further ahead, just like I would, but we do it as we go. We do not believe at this point, and I was speaking to the Secretary of State just last night and to my colleagues in Wales and Northern Ireland, we have no reason at this point to believe that supplies are in any way under threat or that we should have additional concerns about them over and above the unpredictability of delivery timelines that we've always spoken about from the outset. So that's where we are just now. But as I think I've just indicated, we talk about this all the time. So I talk to Matt Hancock and colleagues about it all the time, but so do our officials here in Scottish Government with their counterparts across the other nations of the UK. We've also been very clear on your second point about that the second vaccine dose should be of the vaccine that you received in your first dose. So 1 and 2 should be the same vaccine. And we model that into our forward vaccination plans so that knowing what we reasonably expect to come to us, we can build that in. And I think, as I said a few weeks ago, from the mid to the end of February, we begin in effect running 2 vaccination streams. The second dose vaccines for those who were vaccinated from the 8th of December onwards, and then at the same time, the rollout of the first vaccination dose. And you just start running 2 streams at the same time. Therefore, you need to make sure that the supply you know you're getting can deliver that for you. So that work is constantly underway. In terms of schools, I understand your question. My answer is going to be what my answer usually is at these briefings on a Friday, and that is, as you know, the process that we go through. So we look not just at the daily figures. Daily figures are important, but the 7-day average is important on the number of cases, how they are placed around the country, what the test positivity rate is, remembering all the time that WHO guidance about case numbers under 50, test positivity under 5%. And as we do that and look at the other indicators that we have, then we take a view about whether or not we need to tighten restrictions, can we ease restrictions, and so on. So that goes on for a cabinet meeting every Tuesday and decisions taken at that point. And that's the process we're in the middle of at the moment. I know people want clear answers. I completely understand that. But here on a Friday, it would be wrong for me to attempt a clear answer because we haven't gone through that proper investigative process on all the data. Bruce Mackenzie from ITV Border.
Thank you, Health Secretary, and good afternoon. Today we've been speaking to a lady from Dumfries in her 90s who's had a particularly traumatic experience with would-be scammers around receiving her vaccine. Now, this week we've seen warnings from the NHS and from Age Scotland about the number of different scams that seem to be existing around vaccination offers. And I just wonder, are there more resources going into trying to combat these? And can you just clarify for us once again the process by which people will be invited for vaccine? Will it always, for example, only be by letter?
So just on your last point, it will, as we increase and go down through the ages, be primarily by letter. But for some groups of people, so for very many, in fact, the majority of those over 80, it has been a telephone call or a letter from their GP practice. And I know of some instances where people have been concerned that really is a GP practice and they're asked to phone them back in order to be confident of who they're speaking to. As we go down the age groups, if you like, so those groups that we're opening up for the mass centres, that is primarily a letter, but always with a contact that you can call if, for example, the appointment date or time is not one that you can make and you can make those arrangements. Many of those who are clinically extremely vulnerable will be contacted also by their GP because it will be done through the GP practice, but not all of them. And each health board will be making it clear exactly what the arrangements are in their area. So if you are told you will get a letter and you get a call, then be very, very cautious about that and go back to the national helpline number. Do not give them any information. Go back to the national helpline number, which is widely available, and phone that and double check. So there are a lot of resources going in to try and protect people from scammers, to help them be more alert to that situation. I have to be completely honest with you. I find it utterly appalling that there are some who will choose to use any situation to try and winkle out of people personal data that they will then use for their own purposes. I think that is truly shocking. The vast majority of people in our country are not like that. The The vast majority of people would never dream of doing that. But if you get a phone call or an email that you are at all suspicious of, if anyone asks you for personal data, your bank account, your mother's maiden name, please don't give it. Please stop. Do not open up that email. Do not continue with that call. Go put the phone down and go and check, either using your GP surgery's number, the health board number that will be widely available on their website, or the national helpline number, to double check. And if you think it was a scam, then please make sure that it is reported, because as well as the agencies we're working with to alert people, of course, Police Scotland is very alert to this too, and is looking to make sure that they can track down people who are behaving in this quite despicable way. Thanks very much. Fraser Nichol from Kingdom FM.
Thank you, Health Secretary, and good afternoon to the both of you. You mentioned some differences in the progress of the vaccine rollout between different areas in your opening remarks. Now, NHS Fife says it's ready to move on to vaccinating its next priority group, people aged 75 to 79. But over the Water and Tayside, the health board there is moving on to focus on those aged 65 and over. Could you tell us why there's this disparity between different health boards, and what might your message be to a 74-year-old in Fife, for example, who may have to wait longer than a 65-year-old in Tayside to get their vaccine? Thanks.
So there's a bit of a misunderstanding here, and let me try and clear it up. Every single health board in Scotland and the national vaccination programme is now absolutely focused on those over 70 and those who are clinically extremely vulnerable. That is the group of people that we have made a commitment to, that they will receive their first vaccine by the middle of February, and we are on track to meet that. Where we are also opening up to the next group down, those 65 and over, is primarily in the mass vaccination centres. Now, if you stop and think about the geography of Scotland, a vaccination centre capable of doing up to 20,000 a day, which Louisa Jordan is capable of doing, is not appropriate in every part of our country, because that's not how Scotland's population works. So in those areas, the 65 and over, and some of the 70 and over too, will be vaccinated in what I think of as large community centres. So sports halls that are not being used just now, which we have turned into safe vaccination centres, or community halls. As we go through the programme, community pharmacy will become involved in this too. What we're trying to do is balance three things. Making sure we are working our way through that JCVI grouping, because they set that very consciously on the basis that age is the highest risk factor of serious illness and death. That's why we started with care home residents, elderly care home residents, and are working our way down through the age groups. We're balancing sticking to that with making sure that you can be vaccinated as close to your home as reasonably possible, so that it's easy for you to accept that vaccination invitation. At the same time, making sure equally that we're trying to vaccinate as many people as we possibly can. So all our health boards are doing that. They will all turn their attention to 65 and over. That's why I said that in the course of the next 2 weeks, all 65 and over will receive their letter, whether or not they're being invited to Louisa Jordan in Glasgow or the EICC in Edinburgh. They will be invited to a vaccination centre near to their own home. And if it's not suitable, if it's difficult for them to get there, then there will be a means by which they can look to change where their appointment is or the time of their appointment. And at the same time, those who are housebound, who for reasons of disability or frailty can't easily leave their home, then they will be vaccinated at home. So there are a number of strands to this, and the absolute intention is to make sure that we vaccinate as many people as we possibly can, but that we also go with that JCVI guidance, because that is the guidance that says this group of people, based on their age, are clinically at risk for serious illness and death from COVID-19. So I hope that clears it up. We'll continue to try and make that as clear as we possibly can in our national communications and what our health boards do. But that is the approach that we're taking. Now as we move into a bigger cohort of adults where we don't need to go to their home like elderly care home residents, or we don't need it done exclusively in GP surgeries primarily, then we can open up these other centres and get people in to be vaccinated. Tom Eden from PA.
Thank you very much. Good afternoon. Just following up on the vaccine comments, since the First Minister said she might potentially publish the vaccine supply figures, have the Scottish Government had any sort of potentially panicked calls from the UK Government or any of the vaccine manufacturers about this? And just pick up on something you mentioned in your opening remarks. You said Stornoway Hospital is at full capacity. The coronavirus figures state that the number of hospital patients with COVID in the whole of the Western Isles has only exceeded 4 on a single day, and that was 31st of March last year. So what's happening there? And if it's not because of coronavirus, do you have a plan to either reduce patient numbers or increase capacity to deal with the current outbreak?
Thanks very much, Tom. No, I've not had any panicked calls from either the manufacturers or from any of my colleagues across the UK. In fact, we discussed it last night when, as normal, just at least every week, the 4 health ministers of the UK have a meeting, and we touched on this last night, and I was able to clarify exactly what the First Minister had said and what was our intention. And I have to say, my colleague in Wales understood absolutely why we were now moving to do this, because you can't have, on the one hand, UK government ministers and UK sources, government sources, putting out numbers that we are then not able to respond to because it is commercial and in confidence. That circle doesn't square. So what we will publish is what we expected to receive, what we did receive over a limited period of time, and we will discuss further how we then update that on the basis that what we are publishing is known numbers, not anticipated numbers. And I hope at that point various briefings and so on can cease, and I can just get on and concentrate with vaccinating as many people in our adult population as quickly as I can. In terms of the Western Isles, when I said full capacity, remember it's not just cases, it's also where we have cases of staff and those who then have to self-isolate who have been close contacts of those staff. So it is a balance of pressure on the hospital and staffing capacity to cope with that pressure. And so a number of actions are underway, led by our Chief Operating Officer for the NHS, talking with colleagues in Western Isles Health Board, but also talking with colleagues in NHS Highland and in Golden Jubilee to initiate the standard practice across our health service, which is mutual aid, where one health board comes to the aid of another, either through staffing or by delivering a planned procedure to patients in their hospital, which couldn't be done in their home hospital, but can be done safely elsewhere. So all of that work is underway to ensure that the Western Isles Health Board can cope, and it is coping right now. But that's also why I said to people who are living in the Western Isles, please don't wait for us to reach a view on whether or not we should ask you to move to level 4. Please behave now as if that is the case. Stay at home, limit all your interactions as far as you possibly can, and only interact for essential purposes. In terms of how the health service copes overall, though, I don't know if Fiona wants to add to that.
I think, as the Cabinet Secretary has said, typically the mutual aid that we're seeing right across the country just now is something that happens under normal circumstances and often unseen by the public gaze. What I would want to reassure the population of the Western Isles is if you have any concerns about your health, non-COVID or COVID, please contact 111, NHS 24 or your local primary care provider. Because the NHS is still working, and from a precautionary principle, so that it continued to do that, then we have asked, as the Cabinet Secretary has said, perhaps some elective cases either will not be done or will be done elsewhere across NHS Scotland, perhaps the Golden Jubilee, where that does amazing work of COVID Light, as we would say, is a green site and keeping a lot of our urgent work going that other boards perhaps couldn't do. So it is a case of the service is continuing to run, we're recognising it's under pressure, and NHS Highlands stands ready to help. Right across the Western Isles are supporting each other, and we've put arrangements in place so that we can continue to care for the people of the Western Isles in these very unusual, very demanding circumstances.
Thank you, Fiona. Tom Gordon from the Herald.
Hello there, Health Secretary. On this phone call last night, you said the Welsh Health Minister was sympathetic to your position. Was Matt Hancock sympathetic, or did he continue to resist efforts to publish this data? Also, can you just clarify exactly what it is you're proposing to publish? Is it every day next week, or is it weekly figures, material in Scotland and material at the distribution centre, for instance? And also, do you think the UK government's kind of crying wolf on this? Because I'm looking right now at the UK vaccine delivery plan, and there are numbers given for every cohort of people in every cohort that will get the vaccine. So presumably when the UK government says we will vaccinate cohorts X, Y, and Z by such and such a date, it's very simple to work out how much vaccine supply they have.
Yes, and actually it's not hard to work out how much vaccine supply we expect to have either when we say similar things. In terms of the Welsh Minister was sympathetic, was Matt Hancock. All of them understood exactly what I was saying. And I think it is fair to say that that difficulty in squaring the circle, when numbers come out that are asserted as the supply we have, but we're under a request not to publish those numbers, that circle is really difficult to square. And my view that the people of Scotland deserve clarity on this. What is the supply? Where is it? How does that sit with how many people we are vaccinating in total? That clarity is really important. And that is a view that is shared by my colleagues across the other nations of the UK. The Secretary of State understood what I was saying. I think that is the fairest, without putting words in his mouth, which I wouldn't want to do. He understood what I was saying. So we'll move on, and on to your point about exactly what will we publish. We're working through the detail of that now because, of course, we don't want to breach commercial confidentiality, and we don't want to give anticipated numbers, which may not then, because of the nature of manufacturing and how batches come out and so on and so forth, we've talked about before, may not be realised exactly in the week that we anticipate them. Maybe the following week is actually when we get them, or we get more one week than we thought we would because some of that has come quicker out of the manufacturers. So I don't want to publish something with more caveats than information. So I want to be really sure and clear about what it is we will publish, and then how often would we refresh that. I think that's exactly what we're working through at the minute, and we'll get that all sorted out by the earliest part of next week that we can. I think that was all your questions, Tom. You wanted to come back?
Well, I was just wondering the frequency of this data, because obviously we are getting a daily figure on the number of people who are receiving their JAG. So to make sense of that, do we not need a daily figure on vaccine supply?
Except that as I've tried to explain, it doesn't work quite like that. So vaccine supply and what we expect to get comes to us, or the numbers come from BASE, as part of the UK government, come to us once a week, sometimes twice a week. And the numbers can alter depending on what information they're getting from the manufacturers of the two current vaccines, and there'll be a third added into that, of course. So the numbers that we look at, say, for example, at the start of the week, could have altered up or down by the middle of the week. So it's not as straightforward as me saying on a Monday, I'm going to have this number of doses and I'm going to vaccinate this number of people. It's not as clear-cut as that. But what we will try and do, in order to publish numbers that people can rely on and are as clear as possible, is, as we're doing now, working that through and working through how often we can refresh that going forward in a way that gives you the information that you are reasonably looking for, gives me the clarity that I should be able to give to the Scottish public so that they can see how we are doing as well as. But what really counts at the end of the day is how many people are we vaccinating and how well are we doing against the commitments that we've made. And that's why in the opening today I said we are well on track to meet the commitments that we've made already in this vaccination programme. Let's go to Tom Martin from the Daily Express.
Hi, thank you, Health Secretary. Could I just pick up on the vaccination programme, please? Yesterday, Jason Leach told the COVID-19 committee that appointments had been given out to 200,000 people this week. I just wondered could you clarify what that figure referred to? Because if it's the over 70s and clinically vulnerable, that would mean there's 380,000 people left to get their appointments effectively by tomorrow, get their letters by tomorrow. And on vaccination centres, obviously you mentioned the two other mass vaccination centres opening on Monday, but there's another 2 still to open after that according to the vaccination plan. When will they open? Because at the moment England has 50 of these big sites open. And finally, if I may, could you provide an update on the special blue envelopes that were touted last week for invitations? Have you managed to get some of these envelopes yet ready?
Okay, so let me try and take those one by one, Tom, if I may. I haven't seen what Professor Leach actually said, so going from what you've said, I imagine that what he was referring to was the number of letters that had gone out at the point that he was speaking yesterday. So yesterday was Thursday. We've got Friday, Saturday and Sunday. And there will be more letters have gone out today, there will be more tomorrow, there will be more on Sunday, and so we will keep going. So I don't have any concerns about the fact that we will meet our target to vaccinate those over 70 and the clinically extremely vulnerable and have appointments out to people so that they can be vaccinated by the middle of February. It's just a rolling programme, which takes me to your blue envelope point. So the intention behind the blue envelope, and it remains, is that it is easy to spot. This came out of a discussion with our very important partner, the Royal Mail. Easy to spot in the sorting offices so that they could make sure that they were capturing all the right coloured envelopes, if you like. Easy to spot when it comes through your letterbox too. And the issue we had was we wanted the letters to go out and there wasn't enough blue envelopes to do it. So rather than hang about and wait for blue envelopes to arrive, the right decision was just get them out. Make sure it's an NHS logo on the white envelope. People will know they're expecting it. They're anxious to get their vaccination appointment. And so the letters that have gone out the rest of this week, and as far as I understand and expect over the weekend, will continue to be in white envelopes. Blue envelopes will be introduced once we and Royal Mail have a sufficient supply so that we don't start confusing people with 2 different colours. Right at the minute, white envelope, NHS logo on the front, that is the appointment that you have been waiting for. I'm sorry, Tom, I've forgotten your third question. Oh, your vaccination centres. Thanks very much, Fiona. So we've already got one mass, what I consider a mass vaccination centre, which is Louisa Jordan. 2 others start from Monday, the one in Aberdeen and the one in Edinburgh. I then talk about large community centres. I don't know the detail of what they're describing in NHS England and England as a mass centre. But for example, there will be a centre in Easterhouse opening up, if it's not already opened, which is the sports centre, which can vaccinate up to 2,000 people in a day. Now, some might call that a mass centre. I call it a large community-based centre. So we will have, and we will be able to let you see for every health board, all of those centres. So you will see that across the country, depending on the geography of Scotland and our population sizes, Central Belt has a big concentration of population, Highlands and Islands we talked about earlier, more scattered. South, my own constituency, much more smaller populations with more geographical distance between them. A mass centre in those areas would not be appropriate for people because they'd have to travel too far to get to it. So local centres of various sizes, could be a church hall, could be somewhere like a large sports centre, depends on what makes most sense for the local population is what we will have. And the idea behind all of that is to make sure that we've got big enough premises for the size of the population, but local enough that people can get to it relatively easily so that they can take up their vaccination appointment. Dan Viviers from The Sun. My apologies, Dan, I often get your name wrong.
No worries. Thank you, Health Secretary. We've passed the 500,000 mark on first dose vaccinations, which puts us up to between 11 and 12% of the adult population, but that's still behind each of the other home nations, with England at about 15%. So how soon do you hope to see Scotland catch up now, especially given that the care home residents cohort is more or less got through? And just to follow up on Tom's point, the vaccine deployment plan named Pyramids Business Park in Bathgate, the Ravenscraig Sports Facility in Motherwell, and one other site that I'm forgetting as max vaccination sites, not just community sites. Do you have a date for when those will be operational? Secondly, if I may, you mentioned earlier that people should be sticking to the spirit of the law. Having had several days to look into the matter, do you think Kenny McCaskill's stuck to the spirit of the law by going back and forth twice between his second home in Murray and his East Lothian constituency?
So just to answer your first point, the Ravenscraig site and the other one you mentioned and the others that are in the vaccine deployment plan are standing up and are ready, and they will be running from next week if they've not already begun. Many of them started this week, where I had test runs to make sure that they were safe, that there was a flow, one way in, one way out, that they could do the physical distancing and so on. So I would call those large community sites, not mass. I think that the mass sites are the really big ones, like EICC will be, and the one in Aberdeen, and Louisa Jordan, as people will have seen the photographs of Louisa Jordan. But let's not dance on the head of the pin about the number. Those sites that are in the deployment plan will be opening up, and there are many, many more added to them. And that's a bit my response to about numbers. What counts most to me, what absolutely counts most to me, is that we've got 4.45 million, thereabouts, adults over the age of 18 in Scotland to vaccinate as quickly as we can. And we've got to do that in a way that deals first with those who are most vulnerable to serious illness and death, and then work our way down through the age groups, making sure we pay attention to the clinically extremely vulnerable and to individuals with underlying health conditions as we go. That's what matters. And we have set ourselves very clear timelines in which to do the first groups of those. Firstly, elderly in care homes, frontline patient-facing NHS and care staff, and the over 80s living in the community, that we would have completed those first dose vaccinations by the end of the first week in February, and we are well on track to do that. Those over 70, those who are clinically extremely vulnerable, by the middle of February, and on it goes. That's what counts, that we meet those targets, and if we can, we come in earlier than that. Now, that depends on supply, but I am confident we have the vaccinators that we need, the support staff we need, the locations that we need, and the support of the armed forces as well as NHS staff, many of whom returning to be vaccinators and to be supporters, as well as the British Red Cross helping us with all those volunteers. So that's my focus, not competition. It's not a competition. The competition, if you like, is the competition with the virus. That's the competition. Can I vaccinate as many adults as possible at the same time as all of us are holding back the spread of that virus? That's the race that we're in, and that's the race that we're doing everything we possibly can to make sure that we win. Simon Johnson from The Telegraph.
Thank you, Health Secretary. The European Union has ramped up pressure on AstraZeneca this morning by publishing its contract with the company, basically arguing that it shows that it's contractually obliged to provide the doses from its UK plants if it can't provide them from the European plants where there's been the production issues. I mean, the problem for the UK and for Scotland with this is obvious that the UK plants are making the doses for the UK and Scotland. The UK government has made clear that it would oppose any sort of diversion of UK supplies to the continent, and I just wanted to check, was that also the Scottish Government's position? And on the figures that you're publishing next week, I just wanted clarification that it'll be entirely historical data and nothing, no forecasts, no projections, nothing about the future whatsoever. So I think that's what, from my understanding, is what the UK government is concerned with. Thank you.
So on your last point, I don't intend to publish forward-looking data for all the reasons that I've given, in that information and that flow-through of supply can change up and down. In the round, what counts is actually, as you tally it all up, you know, did you receive in good time what you expected to receive, so you can vaccinate. Point about all of this is vaccinating as many people as quickly as we can. So I'm not intending to publish forward data. In terms of the contract and the UK government's position, so the UK government entered into that contract on behalf of the 4 nations of the UK, but they are the holders of the contract, so they know exactly what's in it, and their job is to ensure that the contract is met, because that matters to all 4 nations of the UK, so that we can get on and vaccinate as many people as possible. And I'm sure that they are in the discussions that they need to be in, and looking to make sure that they can uphold the contract that they have entered into on behalf of us all.
Just check there, would you oppose any diversion of Scotland's supplies to the continent?
So I want the supplies that are due to come to Scotland to come to Scotland. And that's perfectly straightforward. Of course I do. I'm the Health Secretary for Scotland. That's what I want. That's my job. My job is to make sure that I can vaccinate as many adults in our population, 4.45 million, as quickly as I possibly can. So I want supplies to come to Scotland. Paul Malik from the Courier.
Good afternoon, Health Secretary. I was wondering, going back to the Western Isles decision, I'm wondering if you could give any further clarity as to when that decision will be made, and can the entirety of the Western Isles expect to go into that level 4 lockdown? And we've seen, you noted today that 96% of residents in care homes have been vaccinated, but we are still seeing mass outbreaks or sort of large outbreaks in care homes, especially in Grampian, Tayside and Fife. Is this something that the Scottish Government anticipated? And with that in mind, are there any plans moving forward to make sure that people that may be moving into care homes over the next couple of months have had their 2 doses of the vaccine before they're allowed into residences?
Thanks very much. I'll ask Fiona to talk a little bit about care homes, if I may. In terms of your first point about the Western Isles, the discussions are underway as we are currently broadcasting, so I'd expect that decision to be very imminent, whether or not to move the Western Isles into level 4. If the decision is taken, it would be the whole of the Western Isles. Remember that Barra and Battersea are already in level 4 as a response to the very serious outbreak in Barra. So it would be the entire Western Isles. But my point remains, if you're watching this from the Western Isles, don't wait for that decision. Please stay at home as much as possible and really limit the interactions that you have, so that we can control the spread of this virus and make sure that no more people are infected as far as we possibly can. And we need your help to be able to do that. In terms of care homes, I think one of the important points to remember is that at the point when you are vaccinated, your immune response, in other words, your level of protection, increases over a period of 21 days. Fiona will correct me if I'm wrong about that. So at the point when you're vaccinated, you might go out and dance in the street because you're pleased to have got the vaccine, but don't stop doing all the other things that we are asking you to do. Continue to follow facts, continue to stay at home, because, and do that all the way through, but your immune response, your level of protection will increase over the period. Now, some of what we need to do when we're looking at care homes is look at when the first case arrived and how does that sit with when people were being vaccinated in terms of that additional immune response from those elderly residents. But also look at other things, because in care homes, as elsewhere, other measures are really, really important. Good infection prevention and control, the right wearing of PPE, the testing that we are doing on a weekly basis, the PCR test for care home staff, but now supplemented by twice-weekly lateral flow testing. And remember too, that what we know about the vaccine right now is that it protects you from serious illness and death. What it doesn't do, at this point, we don't have the data to tell us that just yet, does it stop transmission from one person to another? So all of that continues to be looked at all the time. That doesn't take away from how important the vaccine is, but we need to be clear-headed about what it can do and what it can't do. Fiona.
Thanks, Cabinet Secretary. And the Cabinet Secretary's covered a lot to the answer. Some early papers that have been published from the rest of the UK are suggesting that where residents in care homes have been vaccinated, the level and severity of illness is not nearly as bad as it was pre-vaccination. And we're taking a number of actions, remembering that discharge from hospital requires 2 negative tests before going to a care home. And we are also taking the opportunity for anyone who's over 80 within a hospital, if they haven't already been vaccinated, we would look to vaccinate them at least by discharge, but certainly at the earliest opportunity. So we're putting a number of protective measures in place to support people. And it goes without saying that Public Health Scotland, the Care Inspectorate, Scottish Government are watching very carefully, as will the manufacturers of the vaccine, this phase 4 of looking at the study of what actually happens in real life when people are vaccinated. So in this case, what happens to the residents of care homes. And I think the Cabinet Secretary said it very, very clearly, just because you're vaccinated, please do not think you can relax other measures. And that goes for the whole population. We need to continue to follow advice, restrictions, so that we can suppress the virus to the lowest possible level.
Thanks very much, Fiona. Rachel Watson from the Daily Mail.
Thank you. We've been talking about first doses of the vaccine. I just want to go to the second. Can you give us a number of how many people have now had their second dose? And are you on track to make sure that everybody gets that within the 12-week period? And also, can I just follow up on Dan's question and get an answer to that, if possible, on whether you think Kenny McCaskill did stick to the spirit of restrictions?
Thanks very much, Rachel. I don't have exactly the number. I'd want to be absolutely accurate about the number of people who've had their second dose so far, and so we'll make sure that we get that to you this afternoon. In terms of second doses, as I said before, the planning that we do, we know how many people we've given the first dose to, and so we build in the second dose planning within the proper time frame so that we are, in effect, from about towards the end of February, early March, running 2 major vaccination streams. At the moment, of course, we're continuing to vaccinate people with their second dose who are coming up to the right time for that to happen, but the numbers there increase as you go through the weeks and the months ahead. So you effectively begin to run 2 pretty major vaccination streams for the second dose and those still to get the first dose. And all the planning and the modelling of anticipated supply and delivery and so on takes account of that. On your point about Mr McCaskill, I think the First Minister has been clear. I've not personally looked at any of the details. What I do know is that the really, really strong message to all of us, there are no exceptions here, is stay at home and only leave home for essential purposes. Work from home if you can. And my view of that is crystal clear. Everyone needs to comply with it. We're asking the population of Scotland to do this yet again, and they are, and I am hugely grateful to them for it. And there are no exceptions. No one's exceptional, and there are no exceptions to it. I think, Rachel, I might have missed a third question from you. Do you want to? No, that's us. Grand. Thanks very much. Mark McLaughlin from The Times.
Good afternoon, Minister. You said that you'll take care to ensure that next week's vaccine publication won't breach commercial confidentiality. Do you accept that the original publication did breach commercial confidentiality and that UK ministers were right to, if not have a hissy fit, then raise serious concerns at least? And it was reported today that some drug companies have clauses in their supply contracts that allow them to suspend deliveries if countries reveal their trade secrets, including the price and the rollout schedule. Have you had an assurance from Pfizer and AstraZeneca that they won't take any punitive action on UK supplies if the Scottish Government breached the contractual terms of the agreement?
So I don't believe at all for 1 minute that we breached the terms of a contractual agreement. What did happen was I attempted to be as clear as possible in the National Deployment Plan with people about the supply chain and the supply numbers, both, and I was clear in that initial publication about what was confirmed and what was expected. The UK government believed that that information should not be made public. I am interested in cooperation across the four nations, so I withdrew that information. That's as much as I would want to say about that. But I go back to my earlier point. The UK government cannot hold that position and expect me to give it due respect, which I have done, and then authorise briefing and also UK government minister statements with numbers that I am not then allowed to respond to. That's simply not a circle that can be squared in that way. And that's why we are looking at exactly what we will publish by way of known supply and delivery. So I've gone through that a couple of times already this morning about how we are looking at that, the conclusions we've yet to reach, how we might refresh that and so on. So that's the position. I would say that I have had conversations with both Pfizer and AstraZeneca. I'm very grateful to them for the time they've given me on that to understand their approaches and what they're doing and how manufacturing works and so on, which has been really helpful. And none of those conversations has any concern been raised by them with me about the material that was initially published. Now, last person is Elsa Meishman from The Scotsman.
Thanks, Health Secretary. I also wanted to ask about second doses. You said we're obviously continuing to vaccinate people who are coming up to being due their second dose, but it's not yet been 8 weeks since the first people in Scotland were vaccinated, and the guidance obviously was changed in December. You said you don't have the exact figures. It's around 7,000 second doses been given in Scotland. The most recent data we have is 500 in one day, on Monday slightly more on Tuesday. In what situations are those second doses continuing to be given? And just secondly, if I may, there's been some confusion over when clinically vulnerable people will be given their vaccine. You told MSPs, I think it was January 13th in your statement, that it would be the beginning of March. But the First Minister yesterday said it should be by mid-February. And some clinically vulnerable people have got in touch with us and they've said this confusion has undermined their confidence in the rollout. So can you just kind of confirm for them what the situation is and give them some reassurance? And just on that, the MS Society has today called for more guidance generally for clinically vulnerable people around getting their vaccine. And I would give them some insurance as well.
So let's deal with the clinically vulnerable group first, as a very important group indeed. I think if you look back at the record, you'll also see that in answer to a question from Joe McAlpine MSP, I clarified that the clinically extremely vulnerable group were in priority group 4, and that priority group, as I've said today and we've said many times, will be receiving their appointments now and will receive their first vaccine dose by the middle of February. That includes the clinically extremely vulnerable group. And there will be a mix of ways by which they will receive their vaccination. They may be invited to those local community centres. Some may be through their GP surgeries, and some may not be able to leave home, and their vaccination will be at home. And the way people can find out about that is by looking at their local health board's website, which will give specific details about how they will be able to, how they will receive their vaccine and how they will hear about their appointment time. I know I've seen some of the coverage on the MS Society's research about a number of people with MS saying that they don't think they've had enough information about the vaccinations. We would take that, we do take that very seriously. We'll talk to the MS organisations about what more information would help those that they represent and work for, and make every effort that we possibly can to maximise the information that we're putting out for people who have MS. Remember that when you go to be vaccinated, the vaccinator has, and Fiona I'm sure will elaborate on this, has a number of very important questions and conversation with you before they give you the vaccine. And that is really important part of making sure that the whole process is safe. In terms of people who will have already received their second dose, I don't have absolute detail about every one of those, and we will confirm with you this afternoon exactly how many as at 8 a.m. this morning. But so I don't know the detail of every single one of them, but the kind of circumstances where you might be talking where someone receives their second dose within the 12-week period, for example, may be that in a care home that was a way of delivering the second dose and making sure that people were covered. Remember that the dosage timeline also changed at a particular point in the whole rollout. So those are the kind of circumstances where the second dose may have been given. They may have been given in some circumstances in order, with a sufficient period of time, if the person was appropriate, in order to avoid wastage, where you've already opened up a vial, you've made up the doses, you've used them all for first dose, and rather than throw out what's left, if you have clinically appropriate people there who would be ready for their second dose, so appropriate timeline, you may use it in those circumstances, because we don't want to waste a single drop of this very precious vaccine if we can at all avoid it. But Fiona, you might want to say a bit more.
Cabinet Secretary is absolutely right. I've had been in communication with vaccinators who've said that very thing, in terms of none of us want even one dose to be wasted. And although we have our priority groups, what the vaccinators had a discussion, and they said, well, if we're out to vaccinate, say, care home staff, and there are a number who don't turn up, what do we do with that vaccine? We either have to throw it away or use it. And in these circumstances, then they can use it with the care home residents. And similarly, if there are other frontline staff who can have a second dose, then they can have it. And I know in some other centres, they may also, to save wastage, offer it. So perhaps GP surgeries, although they would phone people within the priority groups, they would give it to someone who is eligible for it at some stage over the programme, rather than waste it. And that's absolutely right and proper. We are, of course, coming up to the 8-week mark, and we're already having discussion about our care home residents to give people reassurance that we recognise at some stages when there are outbreaks, we wouldn't necessarily go in and vaccinate. So what we are doing in the planning is making sure we can absolutely schedule every single care home resident with their second vaccine, so that they don't trip over the 12-week period. With regard to the Multiple Sclerosis Society and people with MS, some, not all, some are clinically extremely vulnerable and they will then be invited. And I think the Cabinet Secretary talked about from March, and she said that in January. Since then, we've managed to pull forward the programme because of increased supplies. So they will be offered vaccination, and then other people with MS won't be the clinically extremely vulnerable, but they would be in the group who would traditionally get the flu vaccination, and they will be very soon, in terms of Category 6 or Priority 6, be invited for vaccination. A very few will not be suitable for vaccination, and they would have that dialogue with the clinician who's going to vaccinate, or if they want to have that dialogue, they can have it with their primary care practitioner and have the discussion about the balance of risk between vaccination or not vaccination. But all of that will take place during the procedure, and I'm confident that we'll be able to do that for people with MS.
Thanks very much, Fiona. That concludes our journalist questions today. So my thanks to them for joining us. My thanks to Fiona for helping out here and giving clear responses to all of this, and to Anna, our BSL interpreter. But most of all, my thanks are to you for joining us again today. Let me finish up, as we always do, by reminding all of us about the important public health messages that we need to follow without exception. So the basic rule at the moment, the most important of all, is please stay at home. Please do not leave home except for essential purposes, essential shopping, caring for another. If you do leave home, please always remember facts. Face coverings, avoiding crowded places, cleaning hands and hard surfaces, making sure that you maintain that 2-metre distance between you and another, and if you have symptoms, isolate and book a test. If you do go out and you're meeting, please only one other adult from one other household. Work from home if you possibly can. Employers have a legal duty to support people who are working from home. And please, all of you, I know this is tough. I know it feels like yet another week, yet another weekend that we're coming up to, and we're asking you to keep on doing this. But as the vaccination programme rolls out, we will begin to beat this virus. We beat it, though, not just with the vaccination programme, but with all of us following all of that guidance. So please, stay at home, protect the NHS and save lives. Thank you very much.